There are a variety of gauges and lengths of needles used in the veterinary practice. There's your 14 gauge, 15, 16, 18, 20, 21, 22, 23, 25, and 27 gauge needles, all varying in lengths from 3/4 inches to 2 inches. Your most common gauge needles that you're going to see in your veterinary practice will be your 18 gauge, your 20 gauge, your 22 gauge, and your 25 gauge needles. So I have a couple needles here that I'm going to align from largest to smallest gauge. So you have your 18 gauge, your 20 gauge, your 22 gauge, 23 gauge, and a 25 gauge. So some syringes that you'll see in a veterinary practice will be your unit syringes, or your insulin syringes, your 1 ml syringe, 3 ml syringe, 6 ml syringe, 12 ml syringe, and a 60 ml syringe. On the top syringe, there's 8 mLs, the middle syringe has 2 mLs, and the bottom syringe has 25 mLs. So when giving injections, you have a couple different options, depending on the medication that you're giving, the vaccine. You can give them intravenously through the jugular vein, your cephalic veins, or your saphenous veins. For intramuscular, you want to make sure you're injecting that in the muscle, typically in the shoulders or the hind end area. For sub-Q, you want to make sure you're giving that, you can give that anywhere in the subcutaneous layer, typically behind the shoulders. And you're going to bevel up and insert into that subcutaneous layer. So when applying topical medications to equine and bovine patients, you want to make sure that your area is clean, and in some cases you may even need to clip the hair to be able to get the medication down to the skin level. You always want to ensure that you're wearing gloves, and you're going to take your medication, squeeze a small amount on your finger, ensuring not to touch the tip of the tube onto your finger so you don't contaminate the tube. And you just want to do gentle circular motions and apply it to the affected area, making sure that you're covering it generously. So the first thing you want to do when you are reconstituting vaccines and medications is you want to ensure that you have the correct vaccine or medication. So for demonstration purposes, I'm going to keep my needle cap on. But first thing you would do is take your sterile diluent, and you would insert your needle, invert your vial, and draw up your diluent. And then you would take that out and insert it into your powder and inject the diluent. And then you want to give that a good swirl to make sure that all the powder is mixed up, and then you would draw that up. Eat it. Yay! When administering liquid medication to a pet, you're going to take your syringe, you're going to lift up their lip and get as far back as you can in their mouth, and then insert in their mouth behind their teeth, inject the medicine in their mouth, close their lips, and then help them swallow to ensure that they're swallowing that medication.